Hi and welcome to Diabetes TV. Today we're going to talk to you about the different types of diabetes, and it's a common question and often many of the clients that we have, Adam, they don't always know what diabetes actually is, and that produces lots of problems knowing how to manage it. So today we're going to start by talking about the healthy cell.
Yeah, I think the way to understand diabetes is to understand how the body normally works. So the body's made up of billions of cells, so this orange represents a cell. Now what cells have in common is they need glucose for energy. It's like the petrol that runs the cell. Yeah. Now the cell can't get glucose on its own. It needs a hormone called insulin to come along, bind to the cell, open it up and allow glucose to come in.
Fantastic. So if you were to think about it another way, this room is the cell and the people trying to get in the room is glucose, and it's insulin is the key that lets them in.
Absolutely. And that's how a cell normally works. Now in diabetes, what happens is that process is falling down.
Absolutely. So in type 1 diabetes, the problem is actually that the body's not producing any or enough insulin. And obviously that makes it hard for glucose to get into the cell. So they often end up needing to inject insulin. Now this is predominantly diagnosed in children, but can be diagnosed as an adult, and it makes up about 10% of cases. Much larger is type 2 diabetes.
Yeah, and in type 2 diabetes, what's happening is that there's lots of insulin there, but when insulin binds to the cell ignores it. The cell becomes resistant to insulin. And because of that, the glucose isn't getting in. Now the body's response to that, because it picks up that the glucose levels are still high, is it thinks, well, if this much insulin didn't do the job, I'll secrete this much insulin, and it starts to flood your body with insulin.
Yeah.
So your insulin levels climb. Now the problem with that, well, there's two problems.
Yeah.
Is number one is when your insulin levels are really high, you store everything that you eat, like you put on a lot of weight. Now not only do you put on a lot of weight, but you find it hard to lose weight because when your insulin levels are high, it blocks a process called lipolysis, which is the breakdown of fat. So high insulin levels make you put on weight and make it hard to lose weight. And the second fallout of that is because the glucose is not being taken into the cell, it stays in your bloodstream and floats around and destroys some of your tissues, like your nerves and your arteries, because glucose at high levels is toxic.
Yeah, so I guess if you thought of it like rust in a petrol tank, it kind of affects the whole car. And even then, you know, the whole thing with insulin resistance is really that the lock is rusty, that it's not working.
Yeah, back to your analogy
it's not working
before.
very, very well. So type 2 diabetes makes up a very large proportion of the diabetic cases that we see. But there is another type called gestational diabetes, and that makes up maybe less than 3%, and it's in women who are pregnant, and usually it lasts only the term of the pregnancy, but at the end of the pregnancy there can be at greater risk to develop type 2 diabetes. So there you go, they're the 3 different types of diabetes. Feel free to have a look around our website, theglucoseclub.com.au, and have a look at our articles.
See you next time.